Hi, and welcome to the Earthier show. Today, in the 21st century, we are caught up with two aspects. One is diabetes, which is actually becoming an epidemic, not just in India, but across the world. And second is, what do we do with our diet, the 21st century diet? So, to answer that question, we have a very, very interesting guest. Now, Ms. Sucharita Sengupta, she is a bachelor's in clinical nutrition. She's a master's in food processing and nutrition science. And what makes our conversation more unique is that she's a certified diabetes educator. And straight from Kolkata, we have Ms. Sucharita Sengupta.
This episode is brought to you by Earthier On syrup, a natural prebiotic sweet supplement that helps you manage your blood sugar levels. Click on the link in the description to know more.
Happy to have you on the Earlier Wellbeing Show, ma'am. Hi.
Thank you so much. It's a pleasure to be on your show.
Thank you so much, ma'am. Ma'am, let's go straight into the questions and let's start with the basics. Let's cover that first. And now, what is a good diet?
See, I would like to modify the term there's nothing as such good diet. Whatever you can follow, keeping in mind your lifestyle and your medical complications that you have, a more
Right.
precise term that I would like to use is a balanced, a modified, individualized diet. So, what is that healthy diet? So, a healthy diet is that kind of diet which can be adopted to protect against malnutrition in all its form. Now, what do I mean by malnutrition? It can be both overnutrition, it can be also undernutrition. It should also help you to protect certain non-communicable diseases like diabetes, as you have mentioned, heart diseases, stroke, cancer, and so on. So the exact makeup of a diversified, healthy, balanced diet will vary and depend on the individual's background, like age, gender, lifestyle, degree of physical activity, whether the person is sedentary or working, and cultural context, and also where the person is living. So, the healthy dietary practices start early in life. It's not like you become an adult after 18 years of age, you can start adopting a healthy, balanced diet. So, it really starts from the conception, like when a mother conceives. Right from there, the healthy dietary practices start. From there till I would say the last day of your life, it's a total procedure. We say that breastfeeding fosters healthy growth and improves the cognitive development of a fetus, and this can have a longer health benefit on the child. And slowly, when the child adopts to certain healthy dietary patterns and follows healthy balanced diet, you can see the changes the child can have in his or her life without becoming overweight, obese, or developing any kind of NCDs or
Right.
non-communicable disease.
Disease, right. Ma'am, this is so brilliantly put because we have just a one track understanding of malnutrition. You put it beautifully that it's just not undernutrition, it's overnutrition also. And then the second concept of, from a cultural point of view, it's like, not to sound funny, but ma'am, you're from the sweets capital of India, Kolkata. So that cultural aspect, how do you balance that? And then third thing, right from going from childbirth to the last day of the person's life, nutrition, obviously, right from breastfeeding, the mother herself takes so many precautions while the baby is in the womb, and then after that also. And so those kind of precautions, if they are taken or if they are maintained throughout their lives, then they can lead a healthy life or a long healthy life. That's so brilliantly put, ma'am. Ma'am, I would really want to raise another question which has intrigued me, and you are perfect to answer that. Is that, ma'am, you have a master's degree in food processing and nutrition science, and it gives you a very, very unique position to answer a particular question. So, most of the people do not know this, but I think it's a hack which you can tell us is that when you look at a particular product or you buy something from off the shelf, especially food, nutrition, supplements, etc., now, when you turn that thing around, there's a nutrition as well as an ingredient list that is given there. The biggest confusion, this concept about, like you talked about maida. So there are things like, nowadays a lot of packaged foods are coming with the marketed specifically as added dietary fiber or fortified foods. So what is this? And like, or there is like, use of oils, preservatives, additives, coloring agents, etc., etc. That is creating a lot of confusion amongst people who want to maintain a good diet but don't know whether it's good for them, seeing the advertising campaign that has been going on side by side. So that creates that confusion. If you can elaborate a bit on that, that would be great. Yeah.
Surely, surely. For that, initially you have to take the help of an expert, a nutritionist or something, dietitian. But just to be like in a nutshell, I can give you certain example which a person living with diabetes can keep in mind. First and foremost, products claiming as no added sugar. So when you are going in a supermarket to buy any such product, breakfast cereals or whatever be it, claiming that it has no added sugar, you can be rest assured. Just go to the food label part. You will find sugar has been added in the form of fructose, sucrose, high fructose corn syrup, and various other names which is very difficult for a layman to identify. He or she is just saying ki no added sugar. Okay, it's fine, it's natural. But when you are reading the food label, then you can see sugar has been added in other forms. So added sugar is 0 gram, but in the form of various other sugar name, it has been added. And the second is coming to the oil part. Many plant-based oil, they claim that it's zero cholesterol. Now let me tell you something. Plants do not produce cholesterol. It is only the animal who has this ability to produce cholesterol. Plants only produce phytosterol, which is good also. But so when you are marketing your product, which is a plant-based one, as zero cholesterol, it's no point. Like, how can it doesn't have any sugar,
Cholesterol, right?
actually. So this is again something you should keep in mind. So always, if you cannot retrieve the information, decipher the information. It's always better to seek help of an expert. And
Mm.
I ask my patient that you share with me the link or the product details. I'll go through it and let you know whether it's suitable for you or not.
Right.
So that way it can be done. And people with diabetes, living with diabetes, they are like the major target for this because they
Mm.
have a general tendency of sugar craving and all that. No, so
Right.
no added sugar, artificial sweeteners. These are like very good options to them. If they can
Right.
find I'm not adding any calories,
These,
it is not going to spike my sugar levels. So why not? I should take a chance on
it
that.
gives them a false sense of security.
Absolutely.
Right. So, just diving a bit more deeper and looking at the 21st century diet. One part is that you have home cooked meals and freshly cooked meals. The second thing is that a normal person, like, will be consuming a bit of processed foods also, packaged foods also, as well as like, eating out in restaurants and stuff like that. So, especially in the cities, like, people are just going mad. Like, they're trying to understand, where do I strike my balance? And I think the answer to it, I've already guessed, is that speak to the nutritionist.
Yes, this is a very common question that I get on a daily basis from my patients that won't be there any cheat days.
Yeah,
How many days in a week, in a month can I do so? So my
right.
answer is like, yes, you should do cheat days because mental, keeping your mind happy, that is also something you should take care. It's not that you should not have this food, that food, and all. But yes, overall, if you follow a balanced diet, healthy diet, specialized, like keeping in mind your background, the diet has been designed like that. You can
Hmm.
do, you can have outside food. Now, I always give my patients some healthy outside food options. Like it's
Right.
not that whenever you're going out, you have to have pizza. There are
Hmm.
various healthy food options which you can try, like without having something made with butter, ghee, and too much of fried and oily and
Hmm.
spicy items. You can simply go for continental items, which mainly uses grilling technique, poaching technique,
Hmm.
steaming technique. So you should choose your food wisely. like that, you can always strike a balance between having outside food on a monthly basis, and also keeping your blood sugar levels or any suffering from any medical issues. That part also can be taken care of. You have to choose your food wisely. And also, like, if you want to have soup, it's better to go for clear soups rather than the one which uses corn flour.
Right.
So these are certain small changes which, if you can adopt, you can also go for outside food, and also, can enjoy your home cooked
Right.
meal and all.
Right. Awesome, ma'am. And like, Seema, I like the thing, Sucharita, which puts you in a unique position. And guys, if you're watching this video, hit the like button and subscribe, smash the subscribe button, and continue watching the Earthier Wellbeing Show. We are joined with Miss Sucharita, and she is a certified diabetes educator, guys. Now that makes it even more unique. It's not just a education background, a professional background, but even as a certified diabetes educator, she's perfectly poised to answer this particular question that diabetes has reached an epidemic level now in India. And I think there are very few diabetes educators. You'll find diabetes specialists everywhere, but the education part of it is missing on a very very big level, ma'am. And Sucharita, how do you see diabetes as a disease which is becoming it's silently fatal? We all know that. Just let's just discuss on this aspect of diabetes and other non-communicable diseases, and what does diabetes do to other parts of the body?
Yes, certainly. I too believe that having a education, having a knowledge, both practical and theoretical knowledge in certified diabetes education would help you to assess the situation, analyze the disease or disorder in a more in a better way. So basically, we have the comprehensive knowledge of experience in pre-diabetes, diabetes prevention, and its treatment or management, because certified diabetes education is an integral part when you come to diabetes management terms and on. So CDE basically educates and supports people affected by diabetes to understand and manage the condition by helping them to self manage it. We say SMBG, that is self monitoring of blood glucose. So on an individual basis, the person can monitor the blood glucose levels and treat or manage with the help of doctors and nutritionists, of course. So coming to diabetes, which you have already mentioned, a silent killer kind of thing, definitely in many condition, we say if you do not have diabetes, you are in a better position, be it terms of CKD, be it in terms of obesity, whatever it be it. But as soon as you have this diabetes thing added to your medical issues part, it gives you something to worry about. But if you fall under the pre-diabetic zone, then you should start getting yourself treated by a medical practitioner and all. It shouldn't be like, okay, my HbA1c level falls under the pre-diabetic zone. Now I'm not yet diabetic. I'm only pre-diabetic. So, okay, I need not have to worry about that. No, your body is giving you a signal that yes, you are approaching, you may develop diabetes, you are approaching that way. So if you fall under the pre-diabetic zone, then and there you should start taking care of yourself. That is one basic thing which one should get into his or her head. And coming to the causes of diabetes, it's really one cannot say because you have a family history you have diabetes, because of your lifestyle you have diabetes. There are a number of reasons for developing diabetes. I have come across many patients and their family claiming that he or she eats too much of sugar, and that's why he or she has developed diabetes. It's not perfectly right, because there are
Okay.
also patients of mine who doesn't like sweets, who really doesn't take sugar and all on a daily basis and all that, but still the person has been living with diabetes for
Diabetes.
X years. So it is not exactly proportional to the consumption of sugar and all. But yes, if I give you a list of like the causes of diabetes, it can be
Hmm.
lifestyle, genetic makeup, or family history, environmental factor, lack of physical activity, natural insulin resistance, certain hormonal diseases, which causes the body to produce too much of certain hormones, which sometimes cause this insulin resistance, causing diabetes ultimately.
So so that's what, no, like when it comes to layman, when we do not have an understanding of the disease profile, we are not in a position to explain it, not just to ourselves but even to, like, family members, saying that, "Nee, yaar, this guy drank a bit too much beer so he's got diabetes, or he's had too much sugar, he's having too much mishti, so he's got diabetes." So beyond that, also the kind of explanation that you have given makes it pertinent and makes it important for us to understand that if you, in case you are from a pre-diabetic or a diabetic profile, if you have that, it's always best to approach a nutritionist and a dietitian along with your doctor. So that makes it like, you're taking both aspects, the medical aspect also as well as the diet aspect also together, so that you can have a healthy life for a longer period of time. So going on this topic again, is that the most important one, I think, which every diabetic will be interested to know, is that, can diabetes be reversed? Or is it just a myth, and, like, people are trying to upsell their products or trying to sell their plans? Because this is a very important question to a lot of people who have diabetes.
Yes, if the question is it can whether it can be cured, my answer would be no. If the question is whether it can be reversed, my answer would be yes. Now
All
that
right.
doesn't give one impression that it cannot come back. As I have said, it cannot be cured. So yes, diabetes can be reversed. If not, like it can also come back if you
Hmm.
are not following a proper diet and physical activity. So it's a
Sorry to cut you. Reverse diabetes and maintain that reverse level. Can it be done?
Yeah, yes, it can be done. It
Right.
totally depends on the individual, how far, how much the individual is able to do so. Diabetes is like one of the fastest growing diseases worldwide and is rising rapidly in people of all age group. It's not like you are 60 plus, then you have a chance of developing diabetes. It includes both children, adolescents, the elderly group, everything. The condition now occurs basically when the body is unable to produce insulin or cannot use it effectively. So, from heart diseases, kidney problems, stroke, lower limb amputation, chronic diseases poses many health risks to people affected by it. So, although there is no cure for really type 2 diabetes, studies show that yes, it is possible for some people to reverse it. Through diet changes, lifestyle modification, weight loss, you may able to do so and hold normal blood glucose levels without any medication.
Hmm.
But definitely, you have to keep in mind you need to have a modified balanced diet. You need to do some kind of physical activity on a daily basis and self monitoring of blood glucose.
Brilliantly put. So, like, सब बातों की एक बात, maintain that discipline.
Yes.
Right. Awesome. So, like, again, when we talk about, you spoke briefly about, maintaining the right weight also. Ma'am, if you have seen that, there is a huge correlation between diabetes and obesity that is rising across. Like, obesity has become a problem in India also, and there is a correlation between them, both of them occurring together in an individual. And so much so that it is given rise to a particular term called diabesity, which basically combines those two, diabetes and obesity, those two non-communicable diseases. So the first question is, ma'am, which one should I target first? Is it the, like, should I be losing my weight, and then, like, if I'm losing my weight, my diabetes gets okay, or if I'm looking at diabetes, then my obesity will be taken care of? How do we approach this?
Yes, a very relevant question, Abhimanyu, because obesity and diabetes, when they coexist, it really is a matter of serious concern. So the first thing is like you shouldn't be highlighting only obesity part, then you should go for reducing your blood glucose level. both the things should be going hand in hand. Yes, if you are affected by diabetes and you are also suffering from obesity, then the first thing which you should keep in mind is you need to lose your weight. Because when we are doing the management or treatment of diabetes, we always say ki you need to have a healthy BMI, normal BMI. You should achieve a healthy weight by having certain dietary modification and all that. So when you are losing weight, you are cutting down on the fat portion, calorie portion, everything on that. Your body, and as I've mentioned, the insulin part, it's a hormone basically. Your hormone starts behaving in a more natural, in a more normal way. So your body, overall body functions are improved. So you should do both hand in hand, but weight loss or achieving a healthy weight is primary concern.
Ma'am, again, coming back to this point is that, like, some people are over intimidated by this concept of weight loss. So when this weight loss thing hits them, they think that your deadly diet and stuff like that, I need to do this. They never think that there can be a gradual decrease in weight and take a gradual approach towards your weight and towards your lifestyle, rather than taking chock-a-block actions and seeing results in 2 weeks rather than seeing them out in 6 months to a year. What is your opinion on that, ma'am?
See, like a sustainable weight loss should be kept in mind. Like you shouldn't aim for 6 kgs loss in 15 days and then not able to sustain that. And it's basically you have to follow a crash diet, a very bad diet you have to follow to achieve that. So my advice to all, one and all, is always go for sustainable diets which you can follow in the long run. And also the weight loss can be hold on. Like it's not you have lost weight 20 kgs for a wedding or something like that, and after the wedding is over, you are then again gaining weight, coming overweight or becoming obese. So definitely give. So if your body didn't gain weight overnight, so how can you expect your body to lose weight overnight? You have to be patient with your body. So
Right.
give at least 4 to 6 months to see the result.
Right.
The
The reason why I asked this question also is, ma'am, that most of the people in India, they're working professionals. They have their 9 to 5 jobs, and because of their sedentary lifestyle, like sitting in one place and working for a long period of time, and not having that morning or an evening ritual of doing some kind of physical exercise, or in terms of taking yoga as a practice, or taking Pilates or weight training, etc., etc. So these kind of things are not incorporated. So, ma'am, what is the minimum period of time that a person can exercise to actually start the journey of being healthy, or start from an obesity mindset? What should be the minimum things I should be doing, ma'am?
basically 30 to 45 minutes of physical activity on a daily basis, if
Hmm.
not like it is desirable. Now if the person is too busy with his or her work schedule, what I ask my patient to do, you do at least 15 minutes.
Hmm.
Next day, if it is possible, do it for 20 minutes. The zone is
Hmm.
like 30 to 45 minutes daily. But
Right.
this is not something ki if you cannot do 30 minutes, you 10 minutes छोड़ देते हैं, ऐसा कुछ
Hmm.
नहीं है. So you should do whatever you can do, but 30 to 45 minutes on a daily basis is desirable.
Right. And this is like, it just brings me back to the stories during COVID. Like, what do we do if, like, many diabetics were like talking to us and saying that, what do we do? What exercise can we do? I can't go for a walk and this and that. And many people I overheard, or conversations that I heard, was that you clean your house, you do a bit of gardening, take out that first sweat. So even if you cannot do that 30-45 minutes of exercise, if you can do these kind of activities, what is your opinion, ma'am, on that?
Yes, some kind of physical activity you need. It's not that ki you should always hit the gym, you should go for
Hmm.
gymming. swimming, outdoor physical activity I'm not highlighting. It can
Hmm.
be done indoor as well, like certain
Hmm.
indoor exercises or treadmill, or
Hmm.
at least walk here and there inside your room or
Hmm.
terrace, something like that.
Right.
Physical activity in whatever form should be appreciated if the person is
Okay.
unable to do any other kind of physical hardcore activity.
Okay, Sucharita, now we're we are coming more towards the end of the conversation, but it's that since we are coming to the end, I've kept two very important questions for the end. In the meantime, guys, if you're still watching the show, Sucharita's links are there in the description. You can just click on them and visit her page. If you're really interested in talking to her outside this conversation, also you should if you're in Kolkata, you should get in touch with her. If you're not in Kolkata, she will obviously provide those kind of services of nutrition planning and stuff like that. And if you're enjoying this conversation, hit that like button and subscribe to our channel, the Earthier Wellbeing Show. And coming now to the final two questions, ma'am, is that a lot of people nowadays are talking about glycemic index and glycemic load seriously. I've heard these conversations on glycemic index at least 15, 20 years back when they were being talked about abroad. And if you look at it also, ma'am, 20 years back when people were actually being hit by diabetes, there were not many nutritionists that were there. So it was mainly medical practitioners, doctors themselves giving a nutrition chart to a diabetes patient. But since this has become a sort of an epidemic now, there are people who are nutritionists and stuff like that. And India is also the people in India are also understanding what glycemic index and glycemic load is. But for those who have still not understood, can you explain why glycemic index is important for a diabetic person or for an obese person or for people with a lot of non-communicable diseases, ma'am?
Okay. So when you're talking about diabetes, glycemic index and glycemic load should come to one's mind, but both are different. So let me just explain you one by one. Glycemic index is basically a rating tool or a measuring system which gives you an idea about how much of particular food can increase your blood glucose levels, and it is basically used to promote healthy eating habits and help the people suffering from diabetes to create awareness of what to eat in order to keep their weight under check, along with cholesterol part and blood sugar levels. The glycemic index of a food is determined on the basis of certain factors like nutritive composition, processing techniques that the food has undergone, the cooking time, method, and all. Now, the foods are generally rated from 0 to on a scale of 0 to 100, and they are regarded in the same way as low, medium, or high glycemic index content food on their rating. So there are three categories. So low glycemic foods falls under the zone of 55 or below, which are desirable if we are talking about the diet of people living with diabetes. Medium glycemic foods are those foods which have a glycemic index of 56 to 69, and the high glycemic foods falls under the zone of 70 or above. So for better understanding the lower glycemic rating, the longer the food takes to digest, bringing a much slower rise in your blood sugar levels, and hence they are regarded like that. You should always have foods having low glycemic foods and all. This is basically glycemic index. Now coming to the Yes, now coming to the glycemic load part. So while glycemic index is used to determine how much a particular food can increase your blood sugar levels, it does not really reflect on the quantity of food, the quantity part. A glycemic load comes into the picture right now because it shows the number of calories you will be consuming in a particular serving of that food. Here also you will find three categories like low glycemic load content food, which will have a scale of 10 or lower. The second is the medium glycemic load, which will have a rating of 11 to 19, and high glycemic load, which will have a rating of 20 or higher.
As an example, ma'am, if you can just give us high glycemic index foods, like doctors normally prescribe, don't have your potatoes, don't have your polished rice and stuff like that. So can you just explain in terms of like
Yes.
examples?
Yes. So you should always go for whole grains, like it can be millets, it can be millets in the form of jowar, bajra, ragi, oats, whole wheat atta. All this fall under the low glycemic index food. You should aim for this. And also the fruits and vegetables, they are also very nice. The starchy part, like the starchy food, sweet potato, and all that, butter, ghee, all falls under the zone of medium to high. So you should always, yes, high fat content food, you should avoid that.
Right. So, ma'am, there are many natural sweeteners and artificial sweeteners also available, which give certain glycemic index information. So, we're not taking any brands or not taking any products into perspective, ma'am. What does that have? Does that have an effect if we consume that, which is there in, like, multiple products that you get?
It doesn't really add calories to your diet because, as it says, but yes, artificial consumption of any kind of artificial sweeteners, it's not desirable on a long term, because it can, add any diseases. Like there has been a study already published that cancer and all that, it can also occur if you consume artificial sweeteners on a regular basis. So that's why I use artificial sweeteners. Is it a treat or a threat to your body?
Right, ma'am. Ma'am, this is also, like, it's been proposed as theory also that, say you're consuming an artificial or you're consuming an artificial sweetener. So when you consume something sweet, your body normally starts producing certain enzymes or hormones to digest or to manage that particular sweetness. So when you're consuming something which is zero calories or zero GI, what it does is that it keeps creating false positives in your body. And when you actually consume something sweet, your body does not do anything. So these are the kind. There are many theories like this also floating around. What is your opinion on this, man?
See, basically, these
I
are,
mean, it's okay.
yes. So these are basically empty calories in our language. We do not ask any patient, irrespective of the fact that the patient suffering from diabetes or any disorder. Empty calories or zero calories are not good. Even if they sound as okay, it's zero calories, it is not going to add any calories to my 1200 calorie diet plan or something like that. Always aim for healthy calories. That is, if the product or any food item is having 100 calories, it should be good. The calorie content, nutrition wise, it should be good. You should not go for zero calorie or empty calorie thing, because it doesn't have any nutrition. So whatever you are consuming, if you are not adding any calorie, you are actually doing harm to your body.
Right, right. That's like, I think we have understood this glycemic index, glycemic load, and with a couple of examples, I think there is a fair bit of understanding, not just with me, but I think the people who are watching this particular podcast also understand what glycemic index, glycemic and glycemic load do to our body. And now finally coming to the last question, but I think this is the most important question, which a lot of people, ma'am, from my geography, where I come from, Sikkim, as well as in the mountainous regions. For some reason, man, the awareness about HbA1c is very, very low. Do you feel that this it's low in your city in Calcutta? Is it there in cosmopolitan cities as well? Because most of the people, they're looking only at PP and fasting. Now, PP and fasting give you the current reading of that particular time, whereas HbA1c gives you a 3 month average of your blood sugar levels. What is your opinion, ma'am, about HbA1c? Is it a good marker to observe?
Yes, I feel so the same way you feel, because HbA1c, this test gives you an average level of blood sugar levels over the past 3 months or so. Uh, Now, many patients come to me telling ki my fasting level is 300, my PP is 500, but he or she hasn't done the HbA1c test. Now, when I ask the person to do that, often I come across this question from the family members, that before he or she is undergoing the fasting and PP test for 2 to 3 days or something like that, he or she is going through a very strict diet, not consuming anything bad and all, so that his or her levels come a bit in an improved way. So that way you are cheating, right? So but the HbA1c is such kind of test. Whatever you're doing to your body for 3 months, it will just give you the result of that. So HbA1c test is something very, very important if you are a diabetic person. If you are a pre-diabetic, then also it is important, because otherwise you do not know the ranges actually, whether you fall under the zone of pre-diabetes or not. If you do not do the HbA1c test, you cannot say. So the fasting is okay, 99, the PPA is okay, 132, both are normal. But that does not signify whether you are diabetic or pre-diabetic, because at that point of time, during that phase, your blood glucose levels are under control or under checked. But
Right.
general, what is the condition of your body, the HbA1c test only can do that, because it has a higher sensitivity for identifying patients at risk for diabetes versus fasting or PP.
Right. Because there are so many instances, man, that at that particular period of time, their fasting and PP levels are coming normal, but their HbA1c are like uncontrolled blood
Yes,
sugar levels.
absolutely.
So and that gives the person who is either pre-diabetic or who is diabetic, gives them a very good understanding of what actually goes into the management of diabetes in a very very planned way. And I think that concludes this particular podcast, the Earthier Wellbeing Show with Miss Sucharita Sengupta, on the topic of diet and diabetes. Guys, if you have listened to this podcast, I think you will feel enriched with the kind of information that Ms. Sucharita has given to us. And if you really want to talk to her further, if you're in Calcutta or elsewhere, guys, now we are in the 21st century. You just need to hit on her links and you will directly get to meet her and talk to her virtually, like the way we guys are doing, and take advantage of this unique knowledge that she has, of not just from the theoretical aspect, but from a practical of managing diabetes and also understanding nutrition in a very very deep way. Sucharita, we are very very happy that you could join us on this podcast. We feel very happy that you could share some of your experience and some of your knowledge with us on the Wellbeing Show. I'm sure that we'll be meeting in the future and talking, taking more conversations and taking more tips and tricks to manage diabetes in a better way with better diet management. Ma'am, I'm so glad that you could join us. If you really enjoyed the podcast, guys, hit the like button, hit the subscribe button, and I'm really happy that you joined us, ma'am.
Thank you so much, Abhimanyu. It's really a pleasure to be in your show.
Thank you. Thank you.